Brian Andrews is among the first patients in the country to benefit from new thinking in integrated patient care. We'll leave him registering at reception at the Circle Hospital at Peasdown St John near Bath, while we visit Pharmaxo a few miles away in Corsham and speak to a director.
From a medicine's point of view, the advantage for Mr Andrews is when he arrives, he's registered in the hospital systems, he's automatically registered in our pharmacy systems as well. So we get complete allocation of all the medicines that he takes to his name in the system. So we get a much higher level of accountability and audit trail for him. But also, the way we've been able to establish the sort of outpatient dispensing the take-home medicines is that when he leaves the hospital, he goes home with all of the medicines that he requires for his post-operative procedures. His care isn't in any sense handed from one pharmaceutical operator over to another.
So once Mr Andrews is registered on the hospital computer, the technology follows him throughout his care pathway. And key to the smooth running of the system, integrated technology using datasets like the DM&D and SNOMED CT. On this platform, Pharmaxo is providing a comprehensive range of pharmaceutical services. It controls costs, cuts waste, reduces the risk of dispensing errors, and leaves pharmacists free to concentrate on the patient.
Our challenge was really to deliver an outsourced pharmacy service that conform to Circle Healthcare's ideals and objectives, whilst maintaining appropriate quality and regulatory standards. The preferred model that we decided to use was a virtual pharmacy model, encompassing the use of controlled access cabinets situated within the hospital.
As the doctors prescribe and the nurses collect what the patient needs, these smart cabinets tell Pharmaxo what's being used, and their staff replenish supplies. The right drugs in the right quantities in the right place at the right time. The Pharmaxo team leads the hospital in medicines management, formulary and clinical services, providing a full regulatory and clinical governance overlay. Circle is a new hospital, opened just a few months ago by clinicians with a vision of cost-effective excellence in healthcare, and the Pharmaxo offer fitted their needs perfectly.
In historical hospitals, nursing staff would have had to work out how much stock they had, look at whether they had enough for a weekend, for example, reorder it, accept the order in, put it away, etc. Now, working with Pharmaxo, we're able to get on with nursing care, patient care, rather than stocking cupboards.
From the clinician's point of view, we who sit on the executive board found that Pharmaxo were very responsive and professional in getting the policies together and the standard procedures for the whole drug supply side of things. Because the pharmacist is no longer tied up with counting pills and we've got these excellent drug cabinets, I think they're freed up to offer the clinicians more in the way of drug advice about interactions. The patients also benefit because when they've been an inpatient, they can get their drugs, they can get off home, so discharge is speeded up.
The patients, of course, need never know about the cutting-edge technology behind their treatment.
We need to check whether Mr Andrews is still on cocodamol.
After all, they have enough on their minds. This is the first hospital in the UK with outsourced and virtual pharmacy services. And the day can't be too far away when all hospital pharmacies are run like this.